Healthcare could take up the largest part of our state budget this year. Much of that is Texas Medicaid, government health insurance for the poor, disabled, and children. The federal government offers to pay the majority if Texas expands Medicaid to more people. But conservative lawmakers say it is too costly and wasteful. KXAN's Phil Prazen explains how this stalemate leaves 1 million people without health care coverage.
For years, Nathan Robinson tried to rebuild his life after an injury on the job.
Back here, and I got a cut back here.
The scars show it, and post-surgery brought child support and poverty.
When depression takes hold on you, it's not easy. I mean, we've seen that with Robin Williams. Now, he's a man who had money, and depression still got to him. So imagine how much of an impact on a person who is poor.
He's one of 1 million Texans caught in the Medicaid gap, non-disabled, low-income adults who aren't covered by Texas Medicaid but don't make enough money for health care subsidies.
Close that gap!
More than 100 people rallied at the Capitol urging lawmakers to take a deal.
Close that gap!
$9 federal dollars for every $1 state dollar to expand health coverage to people like Nathan. Earlier this year, Texas lawmakers asked Washington for flexibility in Medicaid for cost sharing, price controls, and reform. Washington shows no sign of negotiating.
You know, my story is unique, but it's not much different from anyone in my same situation, who's living under the poverty line, who's been injured, but really wants to contribute to society.
So the staring contest continues between Austin and Washington, and more than 1 million Texans are caught in the middle. Phil Prazen, KXAN News.
Well, here's a look at the gap in health care coverage we are seeing in Texas. On the left are low-income groups who already qualified for Medicaid coverage. On the right are people with income above the federal poverty level. They are covered by marketplace subsidies for health insurance, but if you fall in between, you have no coverage. Right now, that affects, as Phil mentioned, about 1 million Texans.